Good afternoon, everyone. So I want you to imagine that on your next shift, you get called to see an elderly gentleman. He's got complaints of chest pain, and he's diaphoretic and hypertensive. Now, you have no EKGs, labs, cath lab services, and no ambulances to transfer him. So what do? Well, while this may seem like a nightmare, this is the reality when dealing with emergencies in flight year-round. So what do you do when on your next previously relaxing journey, you hear those fateful words overhead? Is there a doctor on board? My reflex response, I'll tell you, I crossed my fingers and prayed someone else got there first. But it was on reflecting on this experience I realized I had to be better prepared. So I came up with 3 questions I wanted answered. What are some of the more common emergencies I would face? What is available to me 30,000 feet in the air? And am I going to get sued should things go wrong? So emergencies are estimated to occur in about 1 in every 600 flights, or roughly 44,000 cases a year. But the true incidence is largely unknown, as there's no real mandatory reporting system. The in-flight environment itself is certainly unique and challenging. There's noise and turbulence and absolutely no concept of privacy, bringing a whole new meaning to the term hallway medicine. Here we suddenly find ourselves challenged with unfamiliar tasks like citing our own IVs, and without those diagnostic modalities we've come to rely so heavily upon. So what emergencies can you expect? Well, the short answer is a little bit of everything. But to be quite honest, it's not that scary. There are some which are truly unpredictable and you will never be prepared for, but thankfully those are in the minority. From what data we do have available, the majority of cases tend to involve syncope, respiratory and GI complaints, and chest pain. And these are things we deal with every day in the emergency room. Now, as to what is available to you, commercial airlines over 7,500 pounds are expected to be outfitted with an AED, and of course the staff trained to use it, and an enhanced emergency medical kit. Unfortunately, the contents of these kits vary widely across airlines. Majority of them will have bag valve masks, catheters, IV tubing, and a variety of drugs to treat your more common or life-threatening illnesses, such as your aspirin, nitrates, and epinephrines. But the specific drug and the amount of medication that you're going to find is going to vary, and especially on those international airlines, where you're likely to find drugs that you're not familiar with. So while there are no hard and fast rules for approaching these scenarios, there are some loose guidelines for you to follow. First, identify yourself and ask for permission to treat the patient. Remember that our assistance is provided at the discretion of the flight crew, and in some cases, you may be required to provide credentials. Be flexible and treat in the seat where possible. In the rare case of a cardiac arrest, or even scarier, an impending delivery, you may be required to find an alternate place to treat these patients. So check with the crew for a more suitable option, but be prepared that this may be the floor. And be resourceful. Check with your fellow passengers, as they may be able to provide equipment which is lacking in your kit, such as glucometers, or assist with other services like translation. But the most important thing is to know your limitations and avoid practicing outside of your scope. This is not the time or place for heroics. The majority of these airlines will employ the services of emergency response centers, so you never have to fear making decisions completely on your own. And while being responsible for the care of the patient and liaising with these ground medical services, you may also be involved with the decision to divert. Now, this is an entirely reasonable suggestion, especially in circumstances such as refractory chest pain or unresponsiveness, but given the cost and the logistics associated with the diversion, ultimately the decision will be left with the pilot. And finally, are you going to get sued? Probably not. The AMA currently covers us as physicians with the caveat that our services are voluntary and without compensation. Unless, of course, you're found guilty of gross negligence or willful misconduct. So my advice, don't volunteer if you've just been sipping on 2 martinis. And I want to leave you all with a thought. Medicine is in a constant state of evolution. And as we progress with technology, we may reach that point where we are no longer constrained by the relative inaccessibility of this in-flight environment. After all, if we could refuel a plane mid-air, then real-time delivery of medication and equipment may eventually be possible. One can only dream. In the meantime, we should embrace the fact that as emergency physicians, we are never not on duty. And improvising in the face of the unknown is exactly what we do and what we do well. So the next time you hear that call overhead, don't be afraid. Step up and volunteer. Thank you.